This is Dr. Selene Parekh, the Fantasy Doctor. There's been a lot of controversy regarding Des Bryant's foot and what is a Jones fracture and what is a normal timeline to heal. So let's relook at this and understand this a little bit better. So here we have a photo of the foot, and if you see here, this is the fifth metatarsal. It goes all the way on the outer part of the foot and goes to the base of the toe, of the fifth toe. Now, a Jones fracture is specifically a fracture of this fifth metatarsal that enters in this area right here where the blood supply is poor to this entire bone. And because it has poor blood supply, it has difficulty healing in all individuals. Without surgery, you're looking at a 20 to 25% rate of this bone not healing. With surgery, where a screw is placed down the center of that bone, that rate drops to about 5%, sometimes up to 10%. Now, the real question is, how much time is it before he can be allowed back onto the NFL playing field? And it really depends on his symptoms. So as he gets examined in the upcoming weeks, if he has no pain or very little pain, he will be allowed to start doing some rehab exercises. That usually starts at about the 2 to 3 week time frame. After that, if he continues to do well, then he will be advanced as he can tolerate all the way up to 4 to 6 weeks. So if he's feeling pretty good at 4 weeks and his x-rays look good, he could be allowed to be back on the playing field. If, however, has more tenderness than the doctors would like, or his x-rays suggest that this bone is not healing, he'll be held back. Now, he can be held back all the way to 6 weeks, 8 weeks, 10, 12 weeks, or even longer. And if you think about Kevin Durant, you know that this can become a problem over time. If this bone does not heal, then he could have another surgery or really require what's called a bone graft surgery, where the hardware is changed out and bone from the hip or other parts of the body are brought into this area to try to get this bone to heal. So we'll have to see how this plays out. It's a fluid issue, but clearly the doctors of the Cowboys are going to be all over this. Speculation will continue to spin all over social media, but 4 to 6 weeks is an aggressive timeline, but it can be done. This is Dr. Selene Parekh, the Fantasy Doctor.